All right, so thank you everyone for coming to another edition of our Medical Monks webinar series, the Monkposium. I just want to say off the bat, we really appreciate everyone supporting us, and we've been doing this for a few months now, and it's been going great. And as always, I just want to point out over to your right in the chat, you can see there's a place to put your comments. We will be having a Q&A at the end. So if you think of any questions to ask our guest presenter here, you can just go ahead and put it over there at any time. I'll be monitoring the chat, so I'll make note of questions, and so we can do that when the time comes. So I just want to introduce Kerri here. We're very pleased to have with us our good friend Kerri Evans, speaking on the treatment and prevention of pressure injuries. Kerri is the Executive Territory Manager for Chronic Advanced Wound Care at ConvaTec, where she's worked for 22 years. Before ConvaTec, she worked in outpatient physical therapy and wound treatment. So without further ado, take it away, Kerri.
Excellent. Thank you so much, Adam and Medical Monks, for having me on today. Very excited to be here with you to talk about a subject matter that I think has affected so many of us or our loved ones throughout the course of time, or perhaps we might have to deal with, something called pressure injuries. So if you've ever heard the term bed sore or bed ulcer or pressure sore, they all mean the same thing. The current term for them is pressure injury, and they are a nightmare to deal with, but they're not the end of the world. So we want to talk about who's at risk for them and some prevention measures that we can actually put into play. But first, we need to identify what in the world they are. So I'm going to pull up a slide presentation here. I want to throw out a quick question, though. If I were to say to you, what is the largest organ in the body? What would you say? I know many people think maybe the heart, they might say something like the brain, or maybe even the liver. But actually, fun fact is, it's our skin. I know it was news to me when I first learned in school that the skin is actually an organ, but it is. And it's the largest organ. It is the most important. I see people in the chat saying it. Most important organ that we have, because it protects us from everything in the environment. And it protects all those other organs that we're talking about, all the other systems. It's very resilient. And I think many of us can take it for granted sometimes. We know that maybe we haven't protected ourselves as well as we could, or taken great care of our skin over the course of time, but it's never too late. So let's just focus on some of the things that we can do to start. And I'm going to pull up a slide presentation here. I think. And Adam, let me see. I might need help trying to minimize me. There we go. Thank you so much. I appreciate it. So pressure injuries in nature, what in the world are they? This is an injury to the skin, and it can be caused by prolonged pressure over top of that area for, again, an extended period of time. It can damage the underlying tissues, and this is just something that can happen from something as simple as a sleep surface or a sitting surface. So yes, that means our bed or our chairs. And the skin or tissues are essentially starved of blood. We know that blood has a very vital function in our bodies. It delivers nutrients and it delivers oxygen to everything, including the skin. And if we don't have that at certain areas of the skin, then our skin's susceptible to breaking down. So there's something else that contributes. It's a force called shear, and this can occur when a person slides down or across a surface. I know I always think about, especially coming up to this time of year when it gets a little bit warmer outside, you're sitting on a park bench or a picnic table and you go to get up, but your skin's stuck to the bench. Does that happen to anybody ever? I know it's happened to me, and you think, uh-oh, I don't want to get right up because that can really cause some damage. So you kind of sit back down and then gingerly peel yourself off of that park bench or that picnic table. And although that might be a very dramatic example, the same thing can occur to you or a loved one if you are bedbound or sitting in a chair for a prolonged period of time. Just the moisture from our skin will allow our skin to actually set up against that surface area. And over the course of time, gravity pulls our body down and it starts to create that shearing force. We don't even know it's happening. So it's a silent contender, but it's an important one and something I wanted to point out. These can actually appear as unrelieved, reddened, intact areas, and that's very important to note. I know you think of pressure injury or ulcer or sore, and you think it's open, it's big, it's gigantic, it's painful, it's oozing. And it can be all of those things, but it can also just be an intact area. So the skin's not broken or open, but it's red or it's darker if the pigment's a different color. And it's not yet a technical open wound, but can be very painful, whether it's shallow or deep, they can actually be painful. Something else that comes into play here is different types of medical equipment and medical devices. I mean, let's face it, we've got so many different medical devices these days. We've gotten much smarter in technology. You think about CPAP and BiPAP machines, things that you can put on your face and it's going to make you sleep better and it's going to give you better clarity the next day. But boy, can it create all kinds of pressure on different areas of our face. Or if we have issues with circulation. I mean, I know I've had to wear different compression hose or TED hose, whether I had surgery or just for different issues. Those are things that can actually cause areas of pressure. Or from a PT perspective, you think about all the braces, whether it's a walking brace or boot or a knee brace. It could be an elbow brace. Anybody who plays pickleball out there, there's a lot of times people are in some type of a wrist or elbow or even a shoulder brace. So those are all things that can also contribute to areas of pressure, not even over top of areas where we would think would be susceptible. And then there's also vulnerability, just affected by temperature, humidity, blood flow, age, which is not a very fair shake in life. But as we increase in age, we also increase in our susceptibility to skin breakdown. And then our overall just general health condition. So we talked about some of these different contributing factors, the first two being pressure and shear, but another one is friction. So if you think of two support areas that kind of slide over top of one another and get very abrasive, that is friction. And friction is another really bad thing that can lead to pressure injuries. So certainly sliding out of bed or sliding kind of in a chair, moving around, especially if it's a rough surface, that can be a frictional force. Decreased mobility. So if you think about it, if you're sick or your loved one is sick, has a particular health condition, or maybe just had surgery, you're not going to be moving a whole heck of a lot. And if that's the case, you're not going to have an ability to offload that pressure, and that can be a risk factor. Sensory impairment is another one, and that could be someone with sensory, individual sensory needs, so someone with special needs in nature. It could be someone who has a condition like diabetes or circulatory issues where you don't necessarily feel everything that's happening in your extremities, like your toes or your feet or even your hands. So that impairment leads you to not know that there's pressure that's actually causing pain and can cause damage. Incontinence is another one. So if you have a loved one that is wearing some type of an adult diaper, or there are underpads used in the support surface that they reside in most of the time, that's something that we can take protective measures we'll talk about, but that's definitely a contributing factor to pressure injury. Reduced level of consciousness can happen for a lot of different reasons. If you're sick, you're not going to be super conscious and aware of what's going on. If you're on certain medications, the same thing can happen. Obviously, if you've had surgery, you're probably going to spend a lot of time sleeping, and again, possibly on heavy medications. And there are all kinds of therapies and treatments that will also reduce our level of consciousness. So our awareness is a bit dulled in terms of what's going on in our own bodies. And that really kind of ties in with the next one, which is the acute, chronic, and terminal illness. Again, that all goes hand in hand. Comorbidities is something that when you go to your doctor's office and you have to fill out the past medical history form, they want to know, do you have a history of heart disease? Do you have a history of respiratory or neurological? Have you had a stroke? So all of those factors, are you diabetic? They're all comorbidities. And if you have any of those, they actually are leading risk factors to potential pressure injury. Posture and deformities is something that we don't necessarily think about, but it's really important. Again, not a fair shake in life, but as we age, we start to lose bone mass. And as we lose bone mass, our posture starts to kind of become compromised, and we're leaning forward. We might be hunched over. The spine, those little bony prominences of our spine might be sticking out more so than they ever were before. So that changes our body, which changes our susceptibility. And the same thing when we say deformities, again, it is no fun, but arthritis can change really the shape of so many parts of our body, whether it's our hands, it can be our feet, our toes, even our knees or our hips. So once that body part changes in terms of its shape, those areas are going to be susceptible a little bit more so to perhaps pressure injury. Impaired cognition, again, goes hand in hand, whether it's medical, surgical, it could be medication induced, or it could be something like a neurological condition, dementia or Alzheimer's, not having that cognitive awareness of what's going on in your body. Psychological stresses, we all talk about that in so many different facets of life. But if there's psychological stress, we're kind of out of our own heads. So we're not thinking about what's going on in our own bodies such that we're taking care of ourselves to know to move and get that pressure off of a certain part. Age extremes, as a society, we're living a heck of a lot longer. So that's a good thing, but we also need to take better care of ourselves so we can have a great quality of life. And the nutritional deficiencies, we will definitely address. That's a silent contender. It is so super important. And if you think about it, if you're not feeling well or just had surgery, you probably don't want to eat or drink a whole lot. So that can be something that can be really detrimental to your skin. I love this slide because it gives us a really good visual of what we're dealing with and what to look for in areas of pressure. If you look at this section on the left, this person is in what's called a prone position, or lying face down. So this is like we're underneath them looking through a piece of glass. And of course, if you're laying face down, you're not going to have your nose right there. You're going to turn your head to the side, which is why you see that. This is a side view of it. Okay, so the areas that we need to be watching for pressure are all of those bony prominences. So that brow bone, okay, typically on the side that they're laying on, the ear, there's a lot of cartilage there, not a lot of fat, so there's not a lot of protection. The cheekbone is something to really be cognizant of, as well as the chin or jawline, okay? The shoulders as well. And then obviously the clavicle area or collarbone area, okay? The lower rib cage, that's what we're looking at right here. So your lower rib cage will really jut out, especially if you're lying face down. These two right here is this one here, which is your hip bones. So those two bony prominences that stick out on the front side of your pelvis, those are your hip bones, and they're always susceptible. This area here is actually your pubic bone. And even though that's buried really deep within your body, depending on, you know, how much fat we're all gifted with and how long we're laying in that position, that could be an area susceptible to breakdown. We also have the knees, which are super bony, as we know. We've got the dorsal or top part of our feet. There's a ton of bones in our feet, so very, very bony there. And then the tips of our toes. Now, this on the right side is called the supine position. So this is if you're lying face up. And let me just take a step back. Why would people be laying face down? You're like, I don't lay face down. Some people sleep that way, but if they had surgery, oftentimes they have to be in a face down position. So surgery for a long period of time can actually lead to pressure injuries, just to kind of caution you there. And also certain medical conditions, certain types of COVID that make you stay in the hospital for a long time, they have to prone the patient for that. So that could be something else. But supine position, there are less areas to watch out for, but they're still very important. Your shoulder blades are big areas there. They're tough to heal. You've got your elbows right here. This area is your sacral area. So right on your behind, that's a real tricky area to protect, but we can talk about that. And then your heels is another area to kind of watch out for. So there's something called human cost associated with this. What is the impact to the person who's dealing with it? First of all, pain. It is no fun to be in pain, especially relative to something like a pressure injury. Social isolation. So it's something that can really prohibit you from wanting to be around others if you have a wound or just aren't feeling well about it. It can lead to depression because you're not feeling so good about yourself. Loss of earnings if you're still in the realm of working and you don't have the ability to go out and work any longer. Embarrassment. I mean, you're a relatively healthy person and you've been able to overcome all of these physical things, but now you have this wound to deal with. So that can be very challenging. And then restricted mobility. That's just part of that negative cycle where you probably weren't able to move a lot to begin with, which led to this problem. It could have been a contributing factor. And now you're restricted even more so. So those are some of the things that impact you should you incur some type of a pressure injury. So some of the prevention measures that we can put into place here, two that are very important, are diet and skincare. And one thing I'll say about diet, because I'm looking at this slide and I see all these numbers and thinking, oh gosh, now I have to do math. The FDA has made it so that we have nutritional facts on everything. So if you get a package of chicken from the supermarket, your nutritional facts are right there for each piece of chicken. You know how many calories are in it. You know how much protein's in it. You know how much fat is in it. Same thing with a restaurant. You can always ask to see the nutritional facts if you get takeout or a fast food type of restaurant. So it's much easier for us to actually do the math these days and know what we need to take into account in order for our bodies to really maintain our skin's integrity and or heal. So we want to make sure that these folks really optimize their nutrition if they are falling into any of those risk categories. They want to consume a sufficient amount of calories. And we're just going to take, for example, a 130-pound patient here. So the average is about 30 to 35 calories per 2.2 pounds of body weight per day. So what that equals is roughly 1,773 to 2,068. So think about it in these terms. We always hear the average daily diet is roughly 2,000 calories a day. But we know if we're not feeling well for whatever reason, we're probably not thinking about eating, not focusing on it. So it could be a real struggle. So really watching that loved one and encouraging them to eat and take in a sufficient caloric amount is really important. Protein is essential, not only for maintaining the skin's integrity, but also for rebuilding the skin should it break down. So 1.25 grams per 1.5 grams per 2.2 pounds of body weight. So we're looking at 74 to 89 grams for that 130-pound person. And again, very simple to do the math. Just look at the nutritional values on the sides of the packaging for whatever you're eating or serving your loved one. And then drinking adequate water. That's another thing. I mean, nobody wants to drink or eat when they're not feeling well. They just don't want to necessarily stay hydrated, but it's essential. So 1 ounce per 2.2 pounds of body weight. We see the ongoing theme there. And that's roughly for the 130-pound person, about 59 ounces per day. And I know my doctors always said about 8 glasses of water a day. So 8-ounce glasses, that's roughly 59, 64 ounces per day. So just something to keep in mind. So if we move over to the right here, we're talking about implementing a skincare regimen, and it is not a luxury to take care of your skin. It is a necessity. I know people think about moisturizing their skin and using all these nice things. You should really be doing it all the time. I mean, I'm guilty of not doing it all the time, but boy, I'm doing it more now so than ever because I don't want my skin to break down. So keeping your skin, first of all, clean and then properly hydrated, not only in the form of taking in water by drinking it, but also moisturizing. The best time to moisturize your skin is right after you shower or bathe, even if it's a bed bath for your loved one because they can't get out of the bed or the chair, whatever the support surface is. Right after that is a good time to put that moisturizing lotion on because the pores are open. So it can help to seal in some of that natural moisture. Cleansing the skin promptly after incontinence episode. So that's tough because you don't know when somebody is necessarily incontinent and they may not know when they're incontinent. So using a moisture barrier, we're jumping down here to the bottom, but some type of protective ointment or barrier in that perineal area is essential. That way that fluid, whether it's urine or feces, is not sitting right on their skin. That can really lead to skin breakdown, and that will protect their skin more importantly. And then avoiding a high pH soap or cleanser, something with harsh agents in it. I always laugh at this one because I think about, I know my mom taught me when I was little, you got to get a lot of lather, got to get a lot of suds in order to get anything clean. And what we've learned over the course of time is the more lather and the more suds there are, the harsher the cleaning agent is in that particular product. So we don't want something with a high pH. We want something that's pH balanced. You can look for that on the label, and something that's also gentle to the skin. Just because it doesn't lather up doesn't mean it's not cleaning. So just kind of food for thought whenever you're looking for products. So some strategies to prevent pressure injuries. It's very important to offload and to reposition. Now, offloading pressure is something challenging at home. Depending upon the condition of your loved one or yourself, I really advise talking to the healthcare provider because they will have a good handle on the general medical condition, what the overall treatment objectives are, and really kind of the comfort and pain tolerance that you or your loved one has, and give you recommendations. If they are bed bound, so they have to stay in the bed, what level of the bed? Like they shouldn't be all the way flat. They shouldn't be all the way up in the bed. They might need propped up on pillows at maybe a 30-degree position or a 30-degree side lying position. Or if they're in a chair, it might be important to obviously instruct them as to how to offload. If they're prolonged periods of time, they're not really thinking about it. We organically do it. I mean, you think about sitting at your desk or sitting at a table, all of a sudden you're uncomfortable. So you just start to kind of move around, but they may not know to move around. So the typical rule of thumb, if they're in a hospital or in a skilled facility or a rehab facility, we usually say every 2 hours they should be turned or repositioned. So encourage them about every 2 hours to kind of move around. It could just be shifting side to side in the chair, or front to back, if they have the ability to use their hands and push up on the arm of the chair, the arms, and lift themselves up, or use an assistive device to stand, that certainly will help as well. And then if there are any medical devices that come into play, again, they can create a lot of pressure on the skin, not even over top of bony prominences. So talking to whoever provided that medical device, if it's a CPAP or BiPAP mask, talking to that respiratory therapy person or the physician who ordered it to say, what can I do to relieve some of the pressure on the face? Because that's really creating a lot of pressure areas on my dad's face, or whatever it might be. Or if it's compression socks or stockings, something of that nature. How long should I be wearing them, or how long should mom be wearing them? Maybe it's only 2 hours, maybe it's 8 hours. Make sure you set the timer so that you can really adhere to that. And then also you can provide physical support underneath the devices to minimize the forces of pressure and shear. We'll actually talk about something here shortly that you can use in that fashion to kind of tuck in there and prevent anything from breaking down possibly. We talked about removing the devices as soon as possible. That's super important. So now we'll get into a product that we have called ConvaFoam. We launched this product about a year ago. It's a really nice foam dressing that's multi-layer. It's a very gentle type of adhesive that is very forgiving. I don't know about you, but I have certainly put bandages on or dressings on over the course of time. And when I put it on, sticks to itself. I try to pull it apart and I can't pull it apart. And then I have to throw it away, or I put it on myself or on my loved one and it kind of crimples up and doesn't really stick very nicely. Same thing, probably have to throw it away. So this particular foam dressing, if you use it in an adhesive fashion, has a very forgiving adhesive that's gentle to the skin and, very importantly, repositionable. It actually contours to the various areas of the body, even challenging areas of the body, which we'll talk about. And it absorbs all types of moisture from the skin. And you think about it, you're like, there's moisture on the skin. If I'm just trying to prevent something like a pressure injury or any type of skin breakdown, why would I have moisture on my skin? There's always moisture on the skin, whether it be in the form of perspiration or just humidity from the climate. The microclimate of the skin actually has moisture on it. So we have something built in which will wick away. We think about wickable clothing. We have wickable dressings that will absorb that moisture. So we actually have 3 different versions of this foam. We've got the ConvaFoam silicone, ConvaFoam border, and ConvaFoam non-adhesive. This is just a cross section. So if you're just looking at it from the side, it just kind of shows you that it's multi-layer. The first layer of the silicone dressing actually has a silicone adhesive. And as I said, it's very gentle, but very effective in terms of it sticking to the skin and being repositionable. And if it does stick to itself, you can pull it right apart and smooth it right back down. And it's not going to be compromised in terms of it adhering to the person's skin. There are perforations that actually are open little holes that allow for the moisture to be pulled away up into the next layer, which is something called hydrofiber or Aquacell. Maybe you or a loved one have experienced a product that had that name. There are lots of products with that name in it from our line, but it's a very absorptive type of material that's very gentle to the skin and will wick that moisture away from the skin. We then have a binding layer and then a super absorbent layer for lots of fluid to be managed, another binding layer, a foam layer, and then a film layer. And that outer film layer is a very soft material. It's tapered around the edges and it's very soothing. So it doesn't catch on your clothing or maybe on the bed linens, which is a nice feature. The border version of this dressing is all of the same things in terms of the layers, but actually the contact layer is just a picture frame of that silicone adhesive. And then there's an open window here in the section that leads up to that absorbent layer, which is that hydrofiber or Aquacell layer. And then we wanted to give an option to folks that's non-adhesive in nature. Some people simply can't tolerate any adhesive because they have known allergies or sensitivities, or their skin is so fragile that it could tear if any adhesive's on there. So the non-adhesive is all of these layers minus that silicone adhesive layer, which kind of begs the question, how in the world do you get it to set up and adhere to somebody? How's it going to stick if there's nothing adhesive? So as I was saying, this could be cut or just used as a whole and tucked down underneath some of these devices, whether it's a mask or a compression sock or underneath some type of brace, or it can actually be secured with a gauze roll or some type of Curlex or tubular retention bandage. So Lots of different nice features with this particular set of dressings. It has the ability to stay in place for up to 7 days, which is so great because you don't have to go changing the dressings. You can actually pick it up and peek and see what's going on with the skin and then seal it back down to see how they're doing and then leave it in place for upwards of that 7 days. Your loved one can bathe and shower with this on. I know I've actually tested it personally and popped in the shower for 7 straight days. Not a problem. It works very, very well. It can cut to contour and conform to any part of the body, which we'll take a look at here, which is really nice because it's difficult to dress different areas of the body. And then there's a pattern film on the outside, which really helps to monitor if there is drainage because you can use it for wound management. But if there's a lot of moisture on the skin, it'll actually show that on the outside of the bandage. It is actually very breathable. And there are some pictures here. If you look down at the bottom, I love this one on the left. These dressings are so friendly. You can actually cut and make these slits to slide down over top of the foot around the toes to protect the top part of the foot, which is a really difficult area to dress. That sacral area we talked about, we've got 2 different sizes that are kind of heart-shaped that are slit down here at the bottom, and it really sits very nicely into that very difficult to dress behind area. The big toe, we actually have a cutting technique that we can teach that shows how to cut this and get that to contour to that area. And then this heel area, we have something called a multi-site, which has 2 slits on either side, and it's almost like wrapping a package. You can actually wrap it right around the heel or an elbow or a knee or even a shoulder, and it contours very nicely. So difficult to dress areas are really pretty much alleviated with this type of dressing, which is excellent. And then lastly, we do have on all of our packages a QR code. The QR code is nice because if you have a smartphone, you can scan that QR code. It takes you right to a landing page where it'll give you 2 options. It gives you either for patients and caregivers or for HCPs, which is healthcare practitioners. You would want to click on the for patients and caregivers portion, and it will take you right to not only videos, but also just kind of walk you through step by step how to use the dressing and some of the frequently asked questions. So it gives you some troubleshooting tips, which is nice and very simple to navigate. So I believe that is the end of the slides. What I was going to do is run a real quick video here, if I'm able to pull this up. Just a quick couple minute video that just shows the application, and then we'll open it up to questions. Okay, there we go.
Okay. All right.
So that is the end of my portion of the presentation. I'll kick it over to you, Adam, see if there are any questions. Be happy to answer.
Sure, yeah. All right, well, everybody who's here, if anyone has a question for Kerri, please go right ahead and put it over there in the chat. In the meantime, we do have a couple of questions from my medical monks colleagues that maybe we can start off with those. I have, one from my colleague. If the patient wearing these dressings is incontinent, will the dressings need to be changed every time any incontinence output touches them?
Yeah, that's a great question. So the answer is that depends. If it's standard incontinence and the dressing is intact around the edges, you can actually wipe it off. Primarily, we're talking about urine. Obviously, if there's incontinence that's fecal matter, then that can be staining and, of course, a bit more to deal with. So in that case, it's best practice to wipe it off, but also most likely change it. For the most part, though, if you're using the protective barrier around the edges there or using something to contain that incontinence, then you might have a better opportunity to let the dressing set up and adhere for a longer period of time. So it is fairly friendly with incontinence overall.
All right. I do see Bob Sexton. I see you requesting to speak here. Unfortunately, we are our capabilities on this this presentation are limited. So if you do have a question, I invite you to please just put it in the chat, type it into the chat there, and we'll definitely answer it for you. But in the meantime, well, we have another one, although you covered it a little bit in the presentation, but can you talk a little bit more about how ConvaFoam can help protect specific areas of the body that, are common for pressure injuries, such as maybe the ankles or different places like that?
Sure. Yeah, the nice thing about the ConvaFoam dressing line is that you have the ability to cut them, or you can get one that's pre-cut to fit those really challenging to dress areas like you're talking about, Adam. So if it is like the ankle area that tends to be very bony, or the heel, or the Achilles region, which is the backside of the heel there, we do have that multi-site dressing that's shaped in a way that has cuts on either side, and you can actually just conform it very nicely and pleat it, just like you're like I said, like wrapping a package to fit that area. The same would hold true for the elbow or the shoulder. So any joint that is going to kind of go into that possibly 90-degree angle, this multi-site is very, very effective. The knee, it's really good for. But if you're like, you know what, I can't get into that, you can actually take a square dressing, and on the videos, it shows you how to cut on either side, and you can pleat it very neatly around that heel or that ankle or the elbows or knees. So very, very versatile in that you can cut it any which way, which is great.
Okay, I see. Sorry, Kerri.
I was going to say, I had a question actually come to me on this side, asking about bathing and showering. Do I have to wrap it in plastic or put a bag over the area in order to bathe or shower with this dressing on? And the answer is no. Actually, you can just make sure the edges are sealed down nicely, and you can go right into the shower or the bath, or if it's a bed bath, like I said, take the washcloth right over top of that area or allow the water to hit it, and it will not compromise the adhesive. It allows it to stay safe and dry underneath, but also intact, which is a really nice feature that it has that waterproofing to it.
I am seeing a question. Okay, I got a question from Bob here. This is actually, this term I'm not familiar with. This ischial tuberosity. Does that sound familiar to you, Kerri? Okay.
Yes, sure
Good.
does.
That's all that matters. So Bob asks if you have ischial tuberosity, a pressure sore, and you're a paraplegic, how much time would you allow that person to be out of bed? Just a frame of mind state is why they're getting out of bed.
Yeah, that's a deeply clinical questions. So the ischial tuberosity, that's technically your butt bone. So when you're sitting for a long period of time, for those of us, just for a frame of reference, and you're like, wow, that bone in my behind really hurts. Those are bony prominences on the backside of our pelvis that actually, especially if you're paraplegic or quadriplegic, the best guidance can be provided, unfortunately, not by me, but by your healthcare provider. So knowing what the time frame to be out of bed or off of that area is obviously something that they could give you guidance on. If there's home health involved, whether it's in the form of physical therapy, occupational therapy, or nursing, you can ask them for the best guidance too, because they have your past medical history profile and they can take into account anything else that's going on with you. So I'm sorry if that's not the answer you're looking for, but to answer your question, there are dressings that will conform to that area for protection over those ischial tuberosity regions, since we have two.
All right, we have a question here from Rena. I'm dealing with an MS patient and she has a pressure sore. There is no muscle because the skin is very saggy and that area is just under the brief elastic under her. I'm sorry, this is getting a little bit. Okay, yeah. So she's asking, if there's an active open bed sore, can these ConvaFoam dressings be used for that?
Absolutely. And it sounds like there's a brief or some type of incontinence situation involved, hence the brief. Saggy skin is very common, especially around the brief elastic, whether it be around the waistband or around the legs. So I understand what you're saying there. And yes, these dressings are actually designed not only to provide skin protection, but also to provide treatment for wounds, all types of open wounds, including pressure injury. So if your patient or your loved one with MS is not already being seen for wound care by a provider, you might want to seek some professional help there, but know that, yes, these dressings are indicated for that, and they can actually do quite a bit of good in terms of managing those types of wounds in those areas.
All right. Is there anyone else that has any questions here? We'll just give it another minute. Well, while we're waiting, I just want to say, Kerri, great presentation. We really appreciate you coming here, and we appreciate your time.
Thank you for having me. It's been my pleasure. Always a pleasure to work with you.
Of course. All right, and I'm not seeing anybody else with any questions, so going a little bit over anyway. So probably call this a day. We really appreciate everyone attending here, and thanks as always for attending the Monkposium. We appreciate all of our customers and everyone in our community here, and just a big thanks to Kerri and to ConvaTec, and everybody have a great week.
Thanks. Bye, everybody.